I'm very proud to introduce to you tonight on this coalition building webinar from HFA, introduce our featured speaker. And her name is Jackie Anderson, and she's with Consumer Voices for Coverage, and she's the Director of State Consumer Health Advocacy for Community Catalyst. Community Catalyst is a national nonprofit organization, a national leader in working to build consumer participation in the healthcare system. And Jackie has over 20 years of experience working with community organizations on social justice issues. She has worked as a social worker, a community development organizer, an educator, and technical assistance provider. At Community Catalyst, she oversees the Consumer Voices for Coverage program, which is an initiative of Community Catalyst and the Robert Wood Johnson Foundation. She also oversees the Southern Health Partners Initiative, and that's Community Catalyst's work in 11 southeastern states. And she oversees Community Catalyst's Affordable Care Implementation Fund, so she is very busy. And I've certainly had the privilege of working with Jackie in the past through the Consumer Voices for Coverage initiative, and she was definitely the first person that I thought of when considering a speaker for this webinar. She combines a great amount of coalition building experience and skill and a passion for healthcare advocacy. I've learned a lot from Jackie about coalition building, and I think that you will too. So Jackie, welcome. Thanks for presenting tonight, and I'm going to hand the screen over to you.
Thanks very much, Jonathan. I am happy to be here with you all this evening, and I look forward to the conversation we can have after when we start. So why don't I begin? Jonathan is giving you a little overview of Community Catalyst. We're a national health advocacy organization based in Boston, and our real vision is that everyone should have access to high-quality, affordable health care. You know, we collaborate with national, state, and local consumer organizations, policymakers, and foundations. And we're working in about 40 states, and are really focused on building consumer advocacy network in those states. And as a part of that, and a little separate from that as well, we run state and federal issue campaigns under the issues of children's health, prescription access and quality, delivery system reform, dental access, and community benefits. So those are all some of the key issues that we are also focused on, in addition to building and supporting consumer advocacy networks in other states. So I just want to start off and talk about, you know, our conversation today is about building and sustaining successful coalition. And I want to just give a terminology I'm going to use throughout this presentation, which is consumer advocacy and health advocates. And what I mean really is you know, we see consumer health advocates as primarily those individuals who represent the interest of people who use the healthcare system, including the uninsured and underinsured and people enrolled in public programs such as Medicaid. So generally, consumer health advocacy organizations and coalitions seek to ensure that quality, affordable health care is available to as many people as possible. So as I go through the presentation, I really will be speaking about these group of people called consumer health advocates, which you guys are a part of. Now, I want to, you know, we're talking about coalitions, but I want to kind of give a larger frame. You know, what are some of the capacities or skills, knowledge, and abilities that advocates need to be effective? And what we see is the first and key thing is advocates need to have the skills to develop winnable policy alternatives. So what does that mean? It means really advocates need to be able to develop and conduct research, analyze complex legal and fiscal policy, health policy issues. You know, they need to, advocates, you know, it's not about just saying no to something. Advocates need to develop policy recommendations that can be effective in enhancing access to health care. And so first, advocates need to be able to develop winnable policy alternatives. They need to build strong grassroots base of support. You know, I know a number of you on the call are volunteers, and so you are the army, you are the grassroots support that helps to move things forward. So as advocates, we need to build popular support among the people who are directly affected by policy decisions. And also, we need to put a human face on the need for better health care. And so not only it's not enough just to identify the policies, we need to build the support among people that are affected by those policies as well. Today we're going to talk about building and maintaining coalitions. So I'm just going to jump over that. One of the things here is develop strategic alliances. It's been shown that advocates really we can move policies, but it often helps when we are connected to other stakeholders as well. Other stakeholders could be people, providers, insurers, other interests. They're usually well organized, deep pockets, and if we can find places where we connect their issue and our issue connect, then it helps us to move our issue along. So that's developing strategic alliances. Media and communication strategies, key area here. We need to effectively frame our messages and frame the issues for the public at large. So our advocates need to be able to develop the skills, knowledge, and ability to also, in terms of communication and media strategies, developing policy campaigns, and finally, generate resources. So you can't do what you need to do without money. And I'm sure you all know that. So I just wanted to kind of give the larger framework in terms of what are the things that advocates need to be effective in their work. And now I'm going to focus some more on the coalition. Benefits of working in coalition. I'm sure you all know this. I'm just going to go over this quickly. When you put a group of folks together, you have increased their strength and relationship, and that helps move an issue forward. So really, the benefits of working in coalition as opposed to yourself is increased and strengthened relationships among groups. Greater visibility for consumers. When you have one advocate at the State House going, I need attention paid to my issue, it doesn't resonate as much as when you have a group of advocates saying the same thing. Helps to have more people you have, the more interaction you can have with policymakers. And it also, the benefits of a coalition, it's bolstered influence on health coverage policy. So the more people, then you can be pushing at different and the same health coverage issues as well. In about 2006, Community Catalyst did a study funded by the Kellogg Foundation that looked at, anecdotally, we've heard that, we had a sense of what it took for consumer advocates to be effective, but nobody had ever documented that. So we did a study, really a benchmark study in 2006 that really tried to identify what is it that it takes to make consumer advocacy effective. And what we found was that advocates need to link together the complementary skills and voices of a diverse collection of consumer organizations through a coalition, network, and alliance. So really, what does that mean? In our study, we found that no one organization has the skills, knowledge, and abilities to move an issue all by themselves. Before at the beginning, we spoke about the capacity needed for effective consumer advocacy. Very few organizations has both the ability to analyze policy, to turn out the grassroots, to build and maintain a coalition and develop strategic alliances, to implement communication and media strategies, to develop and implement policy campaigns, and to get funding. Very few organizations, advocacy organizations, has the ability to do all of those things together. And so advocates really need to come together with these complementary skills and their diverse voices to form what we call a system of advocacy. And so the system of advocacy is really the collection of advocates who come to the table with different knowledge, skills, and ability in order to get the job done. And, what you see in front of you is really our system of advocacy framework. And I just kind of want to walk through it briefly with you. So the system of advocacy framework you see here is really how organizations or advocates can organize themselves to move their policy issues or campaign forward. So oftentimes you have a lead organization that helps to pull a coalition together. So that lead organization then develops what's called a leadership team. Now these terminologies may change, depending on where you are. a leadership team. And the leadership team are a group of folks that have identified a common mission. They're the ones that are the key leaders of this coalition that's going to help to move your agenda forward. So this is the leadership team. They're the ones that are meeting on the phone. They're the ones that are coming regularly together. They've all bought into the principles of the group, and so they're the leadership team, with the lead organization being the central group to help organize them. Then you have partner organizations. Partner organizations may be groups that are not, they don't have the resource to participate as often as as the leadership team members. They are not, they are interested in the issue but can't really put their name to it because of some other political or policy issues that they are working on. They may be, they may be groups that are not as focused on the issue but want to be a part of the effort as well. So they're oftentimes called a partner organization. And then you have on the outskirts the stakeholder group. They're not on the leadership team. They're not a partner organization. They're stakeholder groups such as providers, hospitals, those types of stakeholders. And often the stakeholders are not a voting member. They may be pulled in on various issues. The advocates should be working with them to make sure there's opportunities for alignment on policy, but they're the stakeholder group. And so we see that as a system of advocacy framework. And what it is important to know about this is that this framework really is key to helping knit the work together of the advocates. And so that's a system of advocacy that Community Catalyst has used that really does, and we've seen it successfully used in a number of states, that's really helped to move policy issues forward. Now, I do want to say one thing, and that's don't reinvent the wheel. I am sure you're all in different states with a number of coalitions, and you're maybe connected to some, you may be not, but there are, one of the things to ask yourself, are there existing coalitions in your state through which you can work successfully? And some of the states Jonathan mentioned at the beginning of this conversation, I know of coalitions in all those states. So there are things that you can work, existing coalitions that your issues might align, and that's important. The importance of aligning your policy issues with potentially the coalition's policy issues. So strong health advocacy coalitions exist in Ohio, New York, New Mexico, California, Missouri, Minnesota, Texas. I heard Maine mentioned. Those all have very strong advocacy coalitions. So what successful establishment and maintenance of coalitions? I want to talk about 5 factors. So what is it that makes a coalition successful? So let's start with number 1. I'm going to go through all 5 of them, and then I'll talk about them individually. So find a structure that works, make it operational, communicate regularly, foster leadership and shared learning, find funding. I think that's the 3rd time I've mentioned funding now, so I know it's a key issue for advocates, and I think it's something that all advocates grapple with, so I certainly wanted to make sure I addressed that as well. So first, find a structure that works for your environment. Should it be called a coalition? If you're starting something new, what do you want to call it? Should it be called a coalition, a network, or does it matter? And I would say it really depends on what you're trying to accomplish and what you all agree to. So the arrangement that is most successful is one that works for a specific environment and the partners in that environment. Whatever you call it, there has to be an agreement about what it is. So, oftentimes a coalition is a closer in, like the leadership group that I identify. And then a network is a little wider out. So there are, the coalition could be, you have the leadership team could also be a coalition, and then the network is the next level out. Really, at the end of the day, it is really what the advocates in that state want to call it. And some network is oftentimes a looser grouping. where people just share information, talk to each other. They don't run particular campaigns about an issue. Coalitions are often groups that come together, identify a particular policy campaign they want to run. They identify, okay, this is the issue we're focusing on, and these are the strategies we're using, and this is our ultimate outcome. So those are often a really formalized coalition, but as well, we have networks. We have as somebody mentioned New York, Jonathan mentioned the folks from New York are on the phone. We have a strong coalition in New York, and in Kansas we have a network of advocates that work together. In Georgia, a network of advocates that share information, meet regularly, but they're not as formal a coalition as, say, the New York group that I work with. So, find a structure that works for your environment. Make it operational. What are the needs of this group, and identify your purpose and goals. Whether it's a new coalition or long-standing coalition, there always needs to be clarity on the purpose and goals of the coalition. That is the basic framework on which that coalition is structured. You need to reach agreement on membership, who's in and who's out. Different organizations, different coalitions identify their membership differently. So you need to decide who is in and who is out. Principle, so what are some of the principles that you are going to use as a part of coalition? And principles may be something even such as do not make backroom deals with legislators. That's a key principle of a number of coalitions. Do not do press press releases unless it's the identified spokespeople for that coalition. That's another principle a number of groups use. So really developing some principles. And it's really what are the rules on which we operate by. So those are the principles that need to be developed. And then decision making. How do you make decisions as a coalition? You have a hot issue. The legislators are asking, advocates what they think about a particular issue. How do you make decisions? And how do you make decisions over the long term? How do you make decisions when there is a quick turnaround decision that needs to be made? So those are key things that you need to make, have agreement on. And then promote regular communications and encourage collaboration amongst the group. That is, communication is always a key part of working in this environment. Finally, be flexible. Allow your collaboration style to evolve with the changes in the environment, new relationships, and shifting purpose. Depending on what's happening in your environment, depending on what the issue you are, it cannot be static because things change. People come in and out of the coalitions. Organizations don't have the resources, so they leave. They become advisors. They just want to be a part of the network. So as a coalition, you also need to be really flexible in the work you're doing. Then another piece, I think, is foster leadership and shared capacity building. Establish models for shared leadership, including developing the skills and knowledge of all members of your team. All members of your coalition should have a knowledge of your strategies, your tactics, what are the key policy issues, what the policy recommendations are, ensuring that decision-making is participatory and collaborative, and providing opportunities for all members of the team to have opportunities to be the public face of the team. I think this slide is a really key one in terms of developing a strong coalition. Folks need to feel they have ownership of the coalition, and the way of building that coalition is really fostering leadership amongst the members and helping everybody feel they're at the same place, have knowledge and ability as other members of the team. And yes, one may be more focused on organizing, but they can talk about some of the key policy issues. They're not just about organizing, but they're about organizing in terms of trying to move the policy goals, and they know the policy goals as well. So I think this is a key piece of work that needs to be done when you're talking about successful coalitions, really fostering leadership. And I would also point to the last bullet point, provide opportunities for all members of the team to be a face. it's not just the lead organization, but it's, organization that's doing organizing. They have a role to play. They have opportunities to be out front. And I think that, that's a key work as well. Find funding to support collaboration and staffing. Determine how or if resources will be shared among partners or members. Diversify to sustain the funding support. Just before I go on, I think funding is a key area. A lot of the groups we work with, sometimes one group may get some funds, and what they will do is subcontract some of those funding out. So other groups that may not be as well resourced can sit at the table with them. So the idea of subcontracting mini grants is a key advocacy tool and a key tool for helping to sustain effective and successful coalitions as well. So I just want to wrap up really to say what consumer advocates can accomplish together. By coming together, advocates can demonstrate expertise and credibility. They're able to rapidly respond to issues because of the various knowledge and skills they bring to the issue. Increase capacity to implement a multifaceted campaign. So you not just have one voice, as we started out at the beginning talking about, it's many voices. And this is an opportunity, bringing advocates together to elevate a united consumer voice. And Jonathan, I think that is all I have, and so I will turn it over to you.
That sounds good, Jackie. Can you hear me okay?
Yes, I can.
All right. Before we go on to questions, I want to open the floor quickly to one example of a state that is doing, where a member organization and others are doing a great job in coalition building, and that is New York. It is by no means the only state where that's happening, and I hope that we can hear from some other of you. John Davis, are you on the line?
I am on the call. Can you hear
You
me?
are on the call. We can hear you. You're a little soft. Can you increase your volume at all?
Yeah. A little better?
That's good. That's good.
Okay. Good.
John, you have been active in coalition building in New York, and I wanted to get your perspective and your advice, any tips or lessons you have from your own experience in the hemophilia community, organizing around hemophilia issues in New York.
Sure. Well, for about 4.5 years now, some of the different organizations and the bleeding disorders community have come together and they've formed a coalition. It's called the New York State Bleeding Disorders Coalition. It's a pretty simple name. And in particular to what's going on in New York is you're looking at a state that's fairly geographically, a pretty large state, pretty high population. And you've got a state that has not only a big geographic area, but it's also divided by an upstate and a downstate area. New York City obviously being a high concentrated population. And then, what is referred to as upstate, which is more of a rural community type situation. So you've got some diversity there. And then in addition, coming down to like the bleeding disorders community level, you've got basically 8 hemophilia treatment centers and probably at least as many different hemophilia community organizations. So you're looking at trying to focus like 16 groups from across the state, and it's been relatively smooth over the 4.5 years. We originally started out with obviously a need to form a coalition, and basically a lot of that came from recognizing that we need to keep the health insurance payers fair to not only consumers but to providers. We need to keep our our healthcare network financially stable, so they remain viable, because they offer a specialized um, care to the hemophilia community. And also we need to be affordable by the consumers, and have the consumers be able to have access to all these great clotting factors that are available. So we kind of formed out of that kind of a need, and we came together, and we basically started with an initial meeting. Everybody got to know each other, um, and we got to learn some of the diversity within the group. And I always want to stress that strength in numbers, obviously, more voices. Sometimes that correlates to more votes or direction of votes when it does come to the legislative members. But yeah, strength in numbers, definitely strength in diversity. Reach out to all kinds of people with experience within the community, whether they just be an individual affected or somebody that has a lot of business experience or fundraising experience or public policy experience. And then also what was mentioned on the webinar was the shared resources. It does take money, and sometimes more importantly it does take time, and a lot of us are not full-time, what you call full-time advocators, so we do have to share resources, and we do have to share time in getting the troops motivated, getting the information out, and making appointments and strategizing. So we've had some success. We over the past 4.5 years, we've made a couple points directly communicated to the legislators. One of them is being a ban on Tier 4 prescription drugs, which is becoming a national issue. We were successful in aligning ourselves with some of the other chronic conditions out there, one of them being multiple sclerosis, who initially took a lead on it, and we were kind of joined in behind them. And then right now we're working on getting factor covered for outpatient on our factor health, or our child health insurance plans. So yeah, what I can just stress is definitely the diversity. Reach out to everybody. Sometimes that goes to the more constituents you have, the more chances are that they're a constituent of a rep that are part of a committee, which may have power to put your bill through, whether it be finance, health, insurance. So that's a big one too. Any questions?
I think what we'll do is I actually first have one question, and this can be for you, Jackie. It can be for you, John, and that is, when you're looking to build a coalition and you want to reach out beyond some of the interests or some of the individuals, leaders, groups that you've worked with for a while, and really want to make some new strategic partnerships. Do you have any hints or tips for that? How do you go about approaching a new organization and trying to build that coalition relationship?
John, you want to go first, and then I can follow up?
Sure. How do we approach them? We found what they were doing in the media. It's kind of how we identified potential partners, and directly from what their message was, we kind of see how it aligned with ours, and one of them being with MS organization, and we kind of leaned on some of the national leaders, national organizations. Don't feel, at one point I even called, I was working with ARP, the Association of Retired Persons, because they had a shared commitment, and basically it was just reaching out to their public policy department here in New York State and getting some ideas. So just because you're small or your state or you're regional or local, don't hesitate to reach out to some of the national organizations.
I know that as I was doing some work on Consumer Voices for Coverage, which is RWJF and Community Catalyst Initiative, and I remember getting a call from somebody I think it was MS actually, that they were doing a real big push nationally and locally in their state chapters to really try to connect up with some of the other state advocates in states, and so they reached out to us, and we were able to connect them up with folks in in individual states that we were aware of. So I do think it's about finding groups or finding people that have common issues that you do, whether it's or aligned interests that you can connect with, and that could be in the bleeding disorder community, what issues connects to, whether it's MS, whether it's cancer, whether it's some of the other disease-specific groups. There are opportunities to connect up with folks when if you're meeting somebody, somebody's trying to push the same bill as you are, who's interested in that bill you're pushing, and that could be an opportunity to connect up with folks as well.
Okay. Thanks. What I'm going to do is, we have a lot of really good advocates and experience on the call just in terms of attendees. So if you are someone who have thoughts on a question or a comment to make in response to a question, just raise your hand and I'll go ahead and unmute you, and you can kind of help provide some of the response and the answer. I want to go to another question that we have, and I think it's a really good question. And John, I'll keep you unmuted. Don't feel like you have to respond, but I'll keep you unmuted, and I'll keep you unmuted too, of course, Jackie. And this question says, when coalitions and networks are funded by industry stakeholders, does it make sense to have a formal public statement describing support? And let me ask that again. When coalitions, networks are funded by industry stakeholders, does it make sense to have a formal public statement describing support? And any response to that, John or Jackie, or raise your hand if anyone on the call has any response to that?
Yeah, well, this is John. The response I have to that is it all depends on how visible or how much input that source of funding has in some of the planning. Here in New York, sure, in the background there's some funding that comes from industry, but no way, shape, or form does that source of funding have a direct seat in some of the work that we do. So, and I guess in our case in here, it's not so much necessary, or hasn't come up as being an issue.
I think industry and funding of coalitions is an interesting one, because what I've often said to the coalitions we work with is that what you don't want to do is feel that you cannot take a stand on a particular issue because a key stakeholder has funded your organization or coalition so heavily that you feel constrained when you need to take a particular action. And so I think as folks think about industry and the role that industry plays in their coalition, they just need to understand some of the consequences or the pros and cons of those decisions. And I think being public, I think it's important that it's not hidden that money is coming from industry, because what's going to happen is that may people may not understand. People may think you're being bought off, I guess is the best way of saying it. So I think those are key things that need to be considered.
All right, thank you. If anyone has questions, feel free to type them in and send them to me, or you can raise your hand and indicate that you have a question that way, and I will unmute you. One of the questions that I have that you both touched on a little bit, but I wanted to kind of go back to it because I think it's a huge dynamic for all of us, and that is statewide coalitions. We're looking at member organizations here who cover whole states, or in some cases, part of a state, but that state is huge. Are there certain problems that distance and being a statewide organization has really certain problems or barriers that poses? And how do you keep, given that, how do you keep good communication when you're dealing with people on the other side of the state?
I think state coalitions do have a challenge in keeping their members connected. And so they really do need to focus on how they engage members, the members of the coalition that are not. So oftentimes the coalition is based in the state capitol, close to the state house. And so what I have seen coalitions do is that they have moved their meeting around. They have tried to, every once in a while get to one part of the state so that people go there. Another strategy is a number of people now are, using technology to their benefit, whether it's people Skyping into meetings or conference calling into meetings. So those have been effective. I know one situation where a group used the AARP's office, and AARP has some nice web conferencing, Skyping capabilities. And so they were able to use that to really reach out to members of their, so that the coalition different parts of the state can participate. So I think it's really important to either move the meetings, to use technology as a way of engaging people, not just assume it will always be in that office, in the state, the state capitol. So I think it's important to move around.
Thanks. We are going to go to the other side of the country here. We've heard some good advice from New York. I'm going to open the floor here to Tony Maynard, who's going to talk to us for a few minutes about some lessons that they've learned in the great coalition work that they're doing there in California. So, Tony, can you hear me?
I can hear you. Can you hear me?
Yes.
Excellent. All right. Well, California, I heard you say out in New York it's only been about 6 years. California's had a statewide coalition. We call it the Hemophilia Council of California for over 25 years. It was actually formed in response to the AIDS epidemic, where many of the chapters just wanted to put their head in the sand and didn't want to confront the problem. And we had a particularly advantageous circumstance of having a sister of a person with hemophilia work for staff members in the legislature, high-ranking staff members. So she was able to secure some funding that got some grants that started off the organization. So we had this incredible background that got the organization up and running. We've since seen, some rather large swings in participation and interest and communication. For example, in the early days, we would have a fight between the northern part of California and the southern part of California. We operate much like the Senate in that we have the votes are equal based on the 4 regions, despite the fact that Los Angeles has by far the largest population. And this was a struggle for a long time as to whether Los Angeles wanted more weight to their votes in determining things. And it was a struggle. We had to divide. The president had to be from the north or south, and the vice president had to be from the alternate. Over time, as we've worked together longer as a coalition, we've seen that a lot of those distrusts of other, in other areas have gone away. So currently, we're fortunate because we have put together, pooled our resources. Some of it was left over from the days that we had the grant money, and we're basically to do all our operations through the grants. And so we were able to put this aside a bit of an nest egg, and we have lobbyists that's on staff. So we have somebody on the ground in the State House in Northern California, in Sacramento, which is vital, I think. She has the eyes and ears there at the Capitol. And that is a cost that is shared among the chapters, and it's something that has to be negotiated on a regular basis. It is difficult. We, for the first time in the past few years, put together a fundraising event that is shared for all the chapters. It's a bike ride event. And this is our solution to that point. I heard made many times, funding. We were really having a struggle as to what our future would look like. And so now it's based on participants. You recruit a bike rider from your chapter, and the money is divided between the council and the chapter. And so it was a solution to a problem, but it has taken a lot of negotiation and some generosity for the chapter that originally started the bike ride to turn an event over like that, so that it became a statewide affair rather than just a single chapter's event. But it takes persistence, and it is definitely a challenge, but well worth it. We have a fairly unified voice and are able to have access to state officials because of a functioning coalition.
Thanks, Tony. We had someone submitted a written comment. Oh, go! I'm sorry, Jackie. Go ahead.
No, I was just interested. The gentleman from New York, and John, and I'm sorry I didn't get the name for the person from California. But are you guys connected at all with some of the statewide health advocacy organizations? For instance, in New York, it's a group called, I can't remember their long name, but their short name is HICFANI. And in California, it's Health Access. Any connection to those groups?
Yeah, out here in California, we have worked with Health Access on a number of issues. We have a number of different groups. In fact, we actually had a grant that we were able to coordinate for other disability groups, NAMI and blind organization. I can't remember them. It's been a while since we had it, but we rely on statewide organizations that are already in place where we have common interests. For example, on this pharmacy bill, right now we're running into managed Medicaid issue for Medi-Cal or the Medicaid patients here, and that is a vital aspect. But again, we have an upper hand in having an advocate on the ground who has those connections as well.
Mm-hmm.
That's helpful. It's so interesting to see all the different states, because coalition building sometimes is based on the political dynamics, and oftentimes it's affected by it, obviously, and those are different as we look to the different states. Did have someone submit a comment here, and I think it's a good one. They wrote, another strategy for statewide organizations is to have regional working groups that meet regularly. And that is a good idea. In working in Illinois, we employed that. There's rural areas in Illinois, metro areas, obviously Chicago and Illinois, and it was helpful. We had a Chicagoland working group, and we had a downstate working group, and those are ways to bring in coalition members in in-person meetings that just would not be possible, obviously, statewide. And so that working group model, I think, can work very, very well. And as much as we can get done over the phone and with social media and email and technology such as this, such as GoToWebinar, it's always good to still have that in-person component when you can. There's certain things that you can get done in person that you can't get done online, certainly. If there are any other questions, feel free to put them in. You can type them in, or you can raise your hand. Another question that I had is, a lot of times when you're dealing with coalitions and you're going through many different issues, say, especially if it's a multi-issue coalition, the more people you have, the more differing opinions are going to be possible. And Jackie, are there certain when do you decide to kind of let everyone have their own opinion? When do you decide to really say, no, if you want to be in this coalition, you really have to subscribe to this? How do you navigate that, those dynamics of agreeing on some but not agreeing on another?
I think often, it goes back to that slide when I talked about what's your purpose. So I think it's important that you can have, let's say there's one coalition in Kansas that's focused on Medicaid. The other one is focused on the exchange. And those are two different coalitions.
Mm-hmm.
And so people choose the coalition based on their interest, right? So I think any coalition has to start off with what's our goal.
Mm-hmm.
And also they have to move to what are the principles that we will, as a group, adhere to.
Mm-hmm.
So principles, it can often be the overarching things that hold this coalition together. This is what we all agree to. And when you are advocating at the State House or with legislators or wherever, these are what we can all agree to.
Mm-hmm.
But there will come a time, and I know there's an interest in the bleeding disorders community on the issue of EHB, right? There will come a time where for that issue that people may have to say, I'm with you on the principles, but I have to go off and do my own thing. So we're sign off on the principles, but we also need to, we also need to do our own legislative push on this particular issue that affects our community. So I think in coalition there has to be opportunities for people to say, I can't sign on to this one, but I'm with you on the bigger issue of transparency, the bigger issue of access, and so I think that's how coalitions have to do it. They have to be able to do both sign on to the larger principles, and when necessary, individual organization has to take an individual stance, as long as it's not in direct conflict with the principles that they have signed on to.
I think that's a really good point. Sometimes amidst the urgency of politics and wanting to take action on issues, it's really easy to jump past the principles and to go right into the issues. And oftentimes, the more detailed you get, the greater the chances that there will be divergence. And I know in the work that we did in Illinois, and we learned this a lot from Community Catalyst, in forming the coalition there, it was very helpful to take the time to establish those principles, even if it kind of seems, well, they're broad, and it was those principles and agreement on those principles that keeps things together, even in the midst of diverging views. And we would oftentimes refer back to those principles. And we tried to, at every meeting, to refer to those principles, to remind each other, even though we may have diverse issues on these particular bills or that bill, this is what brings us together, and this is what brings us to the table. One other, go ahead.
Yeah, I think along with that, that's where also the decision making comes in. How are we going to make decisions? And so oftentimes, I think you're correct. People just, oh, it's okay. We all agree with each other. Let's not bother. It's really important because there's going to come a time where there's going to be decisions that need to be made that not everybody can agree on. And so what's the fallback?
We have a question submitted by Mark, and let's see here. Mark, can I unmute you to ask it, or?
Well, my microphone connection's not that good. Go ahead, please.
Okay, we can actually hear you really good.
Oh, then I'll try it.
Yeah,
Okay,
you're loud and clear.
good. Here in the National Capital Area, I'm with the Hemophilia Association of the Capital Area. I'm on the board. Here in the National Capital Area, there's talk of broad weakness in the Hemophilia Treatment Center financial model. Do our very fine spokespeople in New York and California, do you see this as well, and do you have any strategic plans concerning that?
Well, I'd actually have to have you restate that. You say that there's a weakness in the treatment center funding?
Right. In their financial model, it seems like they are saying that it just doesn't seem to work any longer now that there's been a reduction in their funding from a couple of national sources.
Well, you know, we have in California, every treatment center now has a 340B program up and running, and they're aggressive in their marketing to patients, and that is achieving unbelievable staffing of some of these chapters, or some of these treatment centers, to the point that there even is some discussion with the chapters in the state. We have 4 chapters, and some of them feel that the treatment centers are conducting themselves as a chapter and bypassing general chapter functions, such as, you know, community events, because they want to control who's coming to them. So I don't think that we, you know, there's, you know, good sides and bad sides to the 340B program, but certainly funding from in its traditional source through MCHB and through CDC has gone down, and it was never sufficient to run a treatment center. They always had to seek funding through the host, generally hospital. So I don't see anything particularly different other than they have greater resources through the 340B.
Gotcha.
Thanks for your question, Mark. We are nearing the end of our time, but don't log off yet because I want to show you some very helpful resources. You should be looking at my screen right now, and that means you're looking at the HFA website. Can you see that? I'm going to use you as guinea pigs here, John and Tony. Can you see that all right?
Yes.
Okay, good. If you go to HFA's home site, click on the Legislative Action section. You'll be at our Legislative Action Center. And to the left here, you're going to see a bar with a number of advocacy tools. And these are new tools that we've made. Tonight's webinar was on coalition building, so I will direct you to our brand new coalition building page that's been up during the webinar. Here, we've developed a tip sheet. It's just 2 pages on coalition building, how to build and sustain successful coalitions. This is a sheet that we here at HFA have made. It's tailored to bleeding disorders, the bleeding disorders community, to our community. So I would encourage you to visit this page and download that those hints. We will be recording tonight's webinar, and that should be up within 24 hours or so, and you can download that recording. Jackie, I hope this is okay. I should not have assumed, but if it's possible to have the presentation slides or at least any type of information from your presentation, that would be great. We can put that up. Community Catalyst has made a great handout on strength in numbers on coalition building, and there's a number of other resources. We'll probably add some additional ones. So if you want to know anything about coalition building, feel free to log on to that site. Another page that we have is on messaging and talking points. This actually has the recording from our last webinar, which was on messaging, featuring the Herndon Alliance. Words That Work is a brief guide, again, tailored to the bleeding disorders community on how to make our case and being attentive to the words that we use. Those are just two examples of the new advocacy pages and handouts that we have. In terms of policy, there's one on essential health benefits. That's also a new one. We have essential health benefits advocacy checklist. If you want to get a campaign going around that issue or even a coalition going around that issue. And then a number of other resources on essential health benefits. And more of these pages are going up as we go along. Look for the advocacy, it's in your blood logo to see what is new. The advocacy, it's in your blood campaign is what we're calling our comprehensive efforts at advocacy for 2012. So look for that logo for a sign of new things that are going on. This webinar is part of a series. It's part of our third Wednesday webinar series on advocacy and policy. Every other month on the third Wednesday, we have a webinar on a topic that is practical and applicable. Tonight, of course, was how to build and sustain successful coalitions. You can see that July 18, our next one will be on a policy subject, drug and pharmacy issues, which is, of course, huge for our community. If you want to sign up for that and any of our upcoming webinars, simply go to this page. The short title for it is apw.hemophiliafed.org, or you can just go to our Legislative Action Center, click on Advocacy Policy Webinars. You'll see the schedule. You'll be able to get recordings of past webinars, and you'll be able to go right on and log into a webinar. So even though it's, or register for a webinar, so even though it's in July, you can register for it right now. And then finally, I want to mention that many of these resources can be provided for you and your state in the form of a toolkit. We've developed a whole menu or smorgasbord, if you will, of various resources, from talking points to issue briefs to how-to guides. And we can put all of those together for you, custom made for you and for your member organization. And we can even add your member organization logo to it so that it's highlighted. And we can work with you one-on-one to shape and create a toolkit that is most applicable to your state and your organization. And if you're interested in that, feel free to contact me. My email address is on here and my phone number, and we'll work with you not only to make a toolkit that you can have specially made for your advocates, but we'll also make you a toolkit that you can leave behind for your legislators. That when you go to a state advocacy day, when you go to meet with a legislator, you can leave this behind, and it will have your logo on it. It will have some tailored materials to the issues in your state. Those are all available to you, and we're eager to work with you